So I'm really excited to have Emily Douglas, who's professor and head of the Department of Social Science and Policy Studies at Worcester Polytechnic Institute. She's a public policy scientist conducting research on child and family well-being and the child welfare system. After graduate school, notably, she did a postdoc with the renowned family violence researcher Murray Straus, who's I think known to a lot of us. Among her research interests that connect directly with CAFE's work is her exploration of the prevalence and severity of domestic violence against men, and in particular, the help-seeking experiences of male victims of domestic violence, which is what we're going to hear about tonight. I'll also just say on a personal note, I'm extremely pleased that Professor Douglas agreed to give this talk. Those of us at CAFE who do this sort of research in order to make fundraising appeals for some of our work have had a lot of opportunity to dive into some of the statistics and the data that she and her collaborators, in particular Denise Hines, have produced, and we've referred to many of her scholarly articles in the research reports and the fundraising plans that we've prepared. So thank you for providing all of that. We think we put it to good use, and we're so excited that you've agreed to join us tonight. So we're all ears. Please take it from here.
Well, wonderful. Thank you so much for inviting me to be with all of you tonight. We were talking beforehand and just saying, you know, as academics who are doing applied work in the social sciences, you never want your research to sit in, you know, a restricted academic journal. You really want your work to leave the ivory tower, and you want to see the impact of the work that you're doing. So, you know, the COVID-19 is presenting us with a lot of hardship for many people, and then it's also providing us with some unusual opportunities. For example, that on a night in June at 8 p.m. I can join all of you in Canada largely, and I didn't have to fly there, and nobody wonders why I'm not there in person. And instead, I'm here broadcasting from my home, so you might hear my dog bark or my doorbell ring. Anyway, it's really wonderful to be here with all of you. And I'm seeing just in the chats and so forth that many of you are survivors of domestic violence or partner violence, and some of you work in this area and so forth. So it's wonderful to come together and talk about an issue that, of course, is very challenging and disturbing. So I already got a little bit of an introduction there, but I'll also just say I've been doing this work for about 15 years or so. I first started doing this work. Denise Hines and I have done all of our work together. Denise is now at George Mason University in Virginia. And then I've also been lucky to work with some collaborators in 4 English-speaking countries, including Alexandra Lasova, who's in Canada, and then also Elizabeth Shelley, who was in Australia, Louise Dixon, who used to be in England and is now in New Zealand. So the 5 of us have made up an international team of researchers as well, working on this issue. So I guess I will get on to sharing my screen here. And I think that you can all see this, so I'm hoping that that's the case. And if not, that somebody will come on and tell me that you can't see my screen. So, so I am going to talk to you tonight about men's help-seeking experiences. I'd also like to just say I currently am at Worcester Polytechnic Institute in Massachusetts, but starting this fall, I'll be the new chair of the Department of Social Work and Child Advocacy at Montclair State in New Jersey. So after August or September, that's where you can find me after that time. So let me just outline or get us started here to provide some context on what we're going to be talking about tonight. So here are some quotes from male survivors of intimate partner violence. So you'll see we use the acronym IPV for intimate partner violence. Sometimes it's just PV for partner violence. It might be PA for partner abuse. You might see that, although I don't think that's in these slides. And then of course, DV would be for domestic violence. So, you know, these terms are used all very interchangeably in the field. So this man said, I frequently think about suicide. I've called the helpline multiple times, but I stay around to protect and to provide for the kids. And another man said, then our son walked into the bathroom. He was 5 at the time, and my wife's back was to our son. So I brought both knives in close to me so he could not see her with the knives. And instead of helping me hide the knives from our son, my wife stuck one of the blades under my rib cage and the other near my chin and threatened me with them. I looked over at her shoulder and told our son that mommy and daddy were just talking and he should go back to bed and that I would wake him when it's time for school. And so I guess this would be an important time to also say that we're going to have some quotes throughout this, and some of them they describe the abuse experiences. So for those of you who are listening, if that is might be upsetting to you in some way, I want you to know in advance that some of that will be going on. So I'll try to present data and then it will be interchanged with some anecdotes or men's quotes. So we always like to provide this disclaimer, and I think in this particular audience, I don't need to do this, but just to say that acknowledging male survivors doesn't mean that we ignore female survivors or anybody from any other gender identity, or sexual orientation group, and we don't in any way downplay the enormous suffering and pain of female victims. So I'm going to talk about, we're going to cover 4 areas tonight: men's experiences with partner violence victimization, experiences of their children, then men's help-seeking experiences, and then current efforts to help men. And I'm going to do my best to break after each one of these sections, which is more something I tend to do when I'm doing things through a webinar or online, and just check in with everybody and make sure we're all on the same page. I don't want the discussion to go too long. It's really around to see if you have any clarifying points that you might want to ask before we move on to the next section. Things for larger in-depth discussion we can delay until the end, and I'm here with everybody for the full amount of time. And I can also provide everybody with my email address. I'm happy to have follow-up questions, etc. And always looking for opportunities for collaboration. So. All right, so let's start off talking about men's experiences with partner violence victimization. So our best population-based studies, these are largely the US-based statistics, show that anywhere from 20 to 50% of all partner violence victims in a given year are men. And you know, the results, the 20 to 50 may seem like a big range, and it is. And of course, it depends on your source of data. So for example, if you ask people about crime, many people don't think about being hit by their partner as a crime. And so they're less likely to say that they were a victim of that crime. But if you ask people the way often happens in the National Family Violence Surveys and similar types of surveys, if you ask them, if you say something like, you know, couples fight, and when they fight, a variety of things might happen when they fight. And you give them sort of a list of things to check off that happened, which might be pushing, slapping, shoving, including calling a partner names, or it even could be positive things like we negotiated together. But if you give people this behavioral checklist, then you have rates that come up that are with much higher disclosure rates. So I'm going to talk to you about 2 studies that Denise Hines and I have done. There's a lot of literature that's coming out now on this topic, so I'm largely going to be talking to you about the research that Denise and I have done over the past 10 to 12 years. The first is the study of about 300 heterosexual men who had been physically assaulted by their female partner in the past year. All of the men had to have sought help also in order to participate in our research. And in the second study, it's about double the size of that, about 600 heterosexual men who had ever been physically assaulted in a female partner. And you can see the difference there is those who were assaulted in the past year versus those who were ever assaulted by a female partner. These were what are called convenient samples, which means people found out about them by word of mouth. We can't say that it's necessarily a representative sample of men who experience partner violence and reach out. And for those of you who might be researchers in the room or who have paid attention to how data is collected, we use the conflict tactics scale or the revised conflict tactics scale to measure partner violence. And so what I want to do now is just give you a little bit of information about who were the men who participated in our study. And this is from, I think you can all see my mouse, I'm hoping. This is from study 1, and this is from study 2. And so we see that the men were about 40 years of age or so. And we see that their female partner's age is about a similar age to that. These have not been very racially diverse samples, and this is definitely a limitation of our research and something that we hope to move beyond in the future. A little bit more diversity among the men's female partners. Their mean individual income at the time this research was done over the past 10 to 12 years is roughly around the median household income in the US. Maybe a little bit on the low side, but not that far out. Their average, mean is another word for average, so their average educational level was a 2 to 4 year college degree. And then in terms more about their demographics, the average age or mean age of their relationship. Don't worry about these things that are necessarily in the parentheses unless you're a researcher. So these were substantial relationships. These were not short-term relationships. They were lasting 8 or 9 years. In the first study, about half of them were married, a smaller percent in the second study. And you can see in terms of those who were divorced and separated, and those who were still in the relationship, etc. So these were substantial relationships that the men were in. We have the time since the relationship had ended, and then we also have those with the percent of children. So somewhere between 2/3 and 3/4 of the men who participated in our research had children. So this next slide shows you about, and I'm going to walk you through how to understand these slides, the way that we've laid them out. And so this has to do with physical aggression that men would have experienced. And you'll see that the way that this is set up is here on the left-hand side, the left-hand column, we have minor, severe, and very severe physical aggression. So minor physical aggression might be pushing, slapping, shoving a partner. Severe would be something like punching a partner, and then very severe moves, or maybe kicking also would be severe. When you get to very severe, you're moving into the area of life-threatening. So these are things like beating a partner up, using a knife or a gun on a partner, choking a partner, etc. So you should remember that all of the men in this study, in our studies, they had to have been assaulted by a female partner. So that's going to be 100%. They had to have experienced some type of physical assault, and they also had to have sought help at some time. So just remember that going in. So here we have in study 1, the percent who experience these types of violence experiences. And then the next column over is the mean or the average number of times it had happened in the previous year, okay? For study 1. And so you see that about 100% of the men had experienced minor partner violence, severe partner violence, about 90%, and over half of the men in the first study and in the second, as it turns out, had experienced life-threatening violence from their female partners. And then you have the average number of times that this happened in the past year, with minor violence being 32 times. And if you think about what that would mean in terms of like on a per week or every other week, and then very severe, this is men who are experiencing this, say, more than every other month, okay? And then over here, we see similar types of rates, but this is who've experienced it over their entire lifetime ever. So, all right, so I'm gonna move on to the next slide now. And I have some examples now. So this man said she would intentionally pick up the 2-year-old child and then beat on me. And after beating me, she would then spit in my face and beg me to hit her, and I never did. She thought it was funny to punch me in the kidneys. She thought that because I was so much bigger than her, she couldn't hurt me, despite me repeatedly telling her otherwise. Then comes the next question of, one of the pieces of pushback in the beginning. Somebody asked me, "Do you get any pushback around this?" Well, yeah, we actually do get some pushback around this. And one of the things that often comes up is people say, "Well, could a woman really hurt a man? Is that even possible? I just think about the size difference." So those are the kinds of things that get asked. And you'll see that this slide is set up the same way with the types of injuries, and then the percent, and then the average who experienced it in study 1 and then study 2. Now, a minor injury might be something like a small bruise, a cut, being sore the next day in some way or sore after a physical attack. And then severe would be something that you would be more likely to go to the doctor for, to seek medical attention, a broken bones, or a laceration that might require stitches or something like that. So here you have the percent of men who were injured in our first study. Remember, that's in the past year. And that was 75% experienced a minor injury, and then as compared to a severe injury, about a third of the men. And a third of them, and of those men who experienced severe, a severe injury, this happened on average in the past year 4 or 5 times, okay? And you see similar rates over here with men. The sort of prevalence or the average number of times it happens is a little bit lower, okay? And then some quotes from the men. Well, I have scars from my head down. I had 30 burn marks. I had a gun pointed at my head. I was pushed down a flight of stairs and beaten up. This man said, I'm a stage 4 cancer survivor and she tried to harm me during my treatments. While outside, she shoved me downstairs in the snow and ripped open 400 stitches in my chest and refused to take me to the hospital. She also shoved me down outside while feeding the dogs with tubes for chemo and radiation in me. She throws things constantly at me and the scars I have on my chest from illness. This last man said, I was admitted to the hospital with a separated shoulder, a fractured nose, 2 dislocated thumbs, and a through and through puncture wound in my forearm, and many minor injuries. So these men are obviously describing very severe physical aggression, and then severe injuries. I'm going to take a little water here. So for the sake of time, I'm not going to be presenting on psychological aggression or controlling behaviors, and also sexual coercion. These do exist, but I'm just going to move forward without necessarily going into those tonight. So what I do want to talk about is, in our second study, we also looked into something that's that we and others have called legal and administrative abuse. And here what we have is examples of when one's partner uses the legal or criminal justice system or the family court system to perpetrate control, aggression, abuse against their partner in some way. And here are some examples, the examples that we used with the men, that we asked the men if they had experienced it. And so that's what's on the left column. And then in the middle column is the percent of men who were threatened with this behavior by their partner. And then you had the percent of men who actually who were victimized that way, as opposed to just threatened, okay? So we have make a false accusation to the authorities that the partner physically or sexually abused the other partner. Almost 75% of men were threatened with this, and half of them said that it actually did happen to them. Make a false accusation to authorities that the partner physically or sexually abused the children, not the partner, but the children. About 40% of the men were threatened with this, and 25% said this actually happened to them. Leave and take the children away. Threatened is over half, and just under half were actually experienced that. Leave and take all the money and possessions. About 2/3 of the men said that they were threatened with this, and slightly under half said that they were actually experienced that. Ruining the partner's reputation at work and ruining the partner's reputation in the community. Those are rates that are somewhat similar as well. And these are things that we hear about from men quite a bit, actually. It's something that we added to our research for study 2, specifically because of the kinds of qualitative accounts when we gave men open text fields to fill in information about, like, what did we fail to ask you about? What else do you want to tell us? We heard a lot of this kind of stuff in our first study, and then we added in these questions so that we could actually quantify and get a picture of what was the prevalence rate of this happening to the men in our research. Okay, I'm trying to go forward here to the next slide. Whoops. Okay, so that's the opening part about the types of experiences that men have. So I'll just pause here for a moment and see if there are any clarifying questions that people have before I move on to the section about children. And I'll take some more water.
Okay, you can raise your hand. Michael has one. There you go, Michael. What's your question?
Hi, Michael.
Hi. Yeah, my name is Michael Healy, and I was curious about whether you have any research or whether this research that you did has any information on the impact on men of the stuff that you didn't cover, basically the coercive control, the other typologies of abuse other than the physical, because we can kind of see to some degree the impact of the physical. Are we able to measure the impact of the coercive control and the administrative abuse?
Sure. Well, what we can do is really talk about that men who experience all types of partner violence, whether it is physical assault or psychological aggression or sexual assault or legal administrative abuse, that these are men who in general have poor physical health and also struggle with mental health concerns, and also post-traumatic, they have higher rates of post-traumatic stress symptoms. And we can't draw, I'll get a little technical in the research world, we can't necessarily draw a causal relationship because we haven't followed these men over time. It's one point in time, but we can say that there's a strong association. I just have to, as a researcher, acknowledge that it's always possible that somebody who struggles with mental health concerns might be more drawn to a violent relationship. At the same time, it also might be the case that somebody who experiences violence is then more likely to experience mental health concerns. So, yeah.
Yeah, thank you for that answer.
Sure.
I guess if I can do a follow-up, just what I'm trying to tease apart, I understand what you're saying. What I'm trying to tease apart is that, you know, the objection of, well, physically women maybe can't do as much damage. That's a you know, a societal objection to it. We know that they can when they use weapons, of course. But I think there's as much or more damage that can be accomplished by the, you know, coercive control and the psychological abuse and administrative abuse and financial, that has as much or more of an impact on effect on men and probably women in the same situation as well.
Yeah, I mean, I think, I don't think I have slides on that in this particular talk tonight, but certainly men who, I've heard men say, so I don't have quantifiable numbers for you or anything like that, but I've certainly heard men either through qualitative accounts or through our focus group research that we did with the international samples. We've heard men say, you know, it was actually a lot easier to take the beatings or to take being hit. It was really the manipulation of me and you know, being denigrated on a daily basis that was so challenging and damaging to my mental health. So I think I've certainly heard this from men. Yes.
Thank you. I appreciate that.
Let's take one more question.
Thanks, Michael. I see next up is Richard. Go ahead, Richard.
Hi, Richard.
You may need to unmute your mic, Richard.
Yeah. I spend my days on Zoom.
Can you hear me now?
Yes.
Go
Can you
ahead.
hear me now?
Okay.
Yeah.
Sorry about that. Okay, I have a question here. You presented a scenario where a man had his wife pull 2 knives on him while the child was in the room. Do you know how the police handle that kind of situation? Because I would think that under the Duluth model, they would automatically charge or arrest the man for something, or take the man out of that situation. Do you know how the police would even react in that situation? Does your research even cover that?
Yeah, well, I mean, what I can really say is that there isn't really one way that the police are going to respond. And so in some instances where some states in the US and in other parts too of Canada, I think, where they have like the idea that there's a primary aggressor and they try to determine who the primary aggressor is and then arrest that individual. And then other jurisdictions take the approach of a dual arrest policy. So if they arrive on the scene, they arrest both people, both the presumed victim and the presumed perpetrator. And we also know that a lot of this violence is mutual between partners, which isn't necessarily, I don't think that's a part of my presentation tonight, but we've talked about that a lot, about how Violence is oftentimes mutual in relationships, even relationships that don't involve serious violence and in relationships that do. So it, some of the men talk about just terrible experiences that they've had with the police where they're bleeding and the police show up and the police arrest them instead of their female partner. And then other times we've actually heard some men say that it was the police that were the wake-up call for them. The police took them aside and said, you really need to get some help for this. Here's a phone number for victim services. And that was when the men said, victim services, what are you talking about? And that oh, that's me. So, I think in general, overall, men report not having very favorable experiences with the police and sometimes being arrested. But, and I'll get into some of that a little bit later. But there are occasions when, men really say that that was an important moment in their life in terms of their own sort of process of discovery of figuring out that they were being victimized. So.
Okay, thank you.
All right. Thanks, Richard.
I think we're going to return to the
yes,
presentation.
We'll return to the presentation.
I know a lot of you have questions. Hold on to those questions.
It's okay. There's going to be time, I promise. All right. So I'm going back here. Oh, wouldn't you know it? It doesn't allow me to stop. So we're at the children's experiences. And I think you should be able to see this now. Okay, so I think we said at the beginning it was somewhere between 2/3 and 3/4 of men. So we wanted to err on the conservative side of this and say it's roughly 2 out of 3 men seek help for partner violence victimization. I'm not far from an airport, so there's a plane going overhead. And that the average age of the child experiencing this is between 9 or 10 years of age. These children are not necessarily always the men's biological children. We asked if there were minor children in the household that are part of the relationship. So this could be men who are parenting their partner's children too. So just to be clear about that. All right, so then we asked about children's exposure to the partner violence. So you'll see that this color up here is none, and then as it gets darker, it's 52%. Experience severe, are exposed to severe, sorry, I'm just looking at the colors here, severe violence, and 40% are exposed to minor violence. So this was around psychological aggression and insulting, swearing, shouting, destroying belongings, threatening one partner, calling one fat or a lousy lover, or threatening to harm somebody that the person loves, etc. Then you have exposure to physical assault. And we see that about 22% are exposed to minor assault and 40% are exposed to a severe assault. We actually do have rates also around sexual assault, and the rates are very low, but it does happen. Sometimes children are exposed to parents, a sexual assault within their home between the parents or the grown-ups in their home. And then children who are exposed to partner violence really, they struggle, which isn't really necessarily a surprise. We also, in our research, have not only just surveyed men who were experiencing partner violence, but we also at the same time collected a community sample that was representative of men from the greater population. And we asked them about their children's behaviors and so forth. And so we were able to compare men who seek help for partner violence victimization with sort of the general population. And so that's what these comparisons are based on. So kids whose dads seek help for partner violence victimization, those kids are 6.5 times more likely than kids from the general population to experience anxiety. So I hope that makes sense, what I've just said. And then we have somatic problems. These include things like being tired and having aches and nauseous and vomiting, dizziness, complaints about the skin, stomach, or eyes. These kids are, so kids whose dads seek help for partner violence victimization are 6.5 times more likely to experience these problems than kids from the general population. We see elevated rates at 2.7 times more likely to experience attention deficit and hyperactivity behaviors, close to 3 times as many, and then 9.5 times as likely to experience conduct problems as kids compared with kids from the general population, which include things like aggression, destruction of property, being deceitful, violating rules, etc. So here's a few examples of men's accounts of children's adjustments. And so this includes one night before bed, I finished reading him a story and I kissed him goodnight. He grabbed my arm and wouldn't let go. He was genuinely terrified of his mother and afraid of what she would do next, and he didn't want me to leave him that night or ever. This next man said eventually the children, refused to do anything to assist with family duties or chores. All they did was get drunk, get high and steal stuff from the house. They wrecked our cars, they got arrested. They exhausted all of our finances for legal bills for the children. So this is clearly a family system that is really just dealing with a lot of challenges and dysfunction, without a doubt. And that creates stress and tension on a couple as well. I guess I'll stop there and see if there are any clarifying questions around kids and their exposure to partner violence.
Okay, we had a couple of folks. Oh, now only Ashish. Okay, Ashish, I assume your question is still on point in terms of where we're at in the presentation. You now have rights to speak. Go ahead.
Thank you and hi. First of all, I would like to say thanks for this initiative and sorry because I joined at 8:30 approximately, so I missed a lot. But when I came, I saw a nice slide about men abuse and what kind of abuse the men are victims. And the whole table, I see myself there, the whole table from the top to the bottom. That's just to say that it is so true, and it appeals to me like, oh my God, it happened to many other people too. It's not only me.
Yeah.
So it's just an introduction to my story. October 11th, my wife did a death threat to me while my children both were with me, 10 years and 4 years old. They were with me, living apart from her in the same home. She came with the scissors and tell me that she will make me sleep for lifetime. I had put a camera in my room that was catch. The next night, she banged her head in the wall. I had my daughter in my hand. She pulled me, she grabbed me, she kind of make me angry, sorry for my English, so that I react, but I never react. She was doing that since last 1.5 years to 2 years. So, and she called police multiple times. They never arrested me. They even said to me, be careful, we know this pattern, we know she's lying, she will put you in trouble.
Ashish,
Yep.
this is not the right time to share your story. This is for questions related to the presentation.
Yep.
We do have services that we provide to individuals who have experienced abuse, and I'm so sorry that you're one of those individuals, and I'd like to talk with you privately offline, but right now we have a very short window of time for specific questions.
Sure, sorry for that.
That's okay. That's okay. We're just taking questions from folks who have questions just on the information I just presented. It was about 5 or 6 slides. So it sounds like you maybe have a sort of a longer question. So I'd like to invite people to ask 1 or 2 more questions that are specifically to regard to this section around children who are exposed to partner violence.
Right, thank you very much.
Yes, no problem.
And I excuse myself, I will go straight to the question. We can talk later about the detail offline. So the question is, today I just realized the victim services from the court has sent me an email saying that my ex-wife, well, we are still married, will be released on a peace bond for 9 months. That's it. So, and she was arrested, by the way, for death threat, not for the abuse and the mischief, because it was not in the video. However,
I'm really sorry to do this, but once again, could you please state your question?
so the question is, she was just released, and she is basically, she did a court case against me with lots, 54 allegations, all crazy more than the others. And I don't know how to treat this situation because CAS have made a big report.
Thank you for the question, Ashish. Thank you for the question.
I'm very sorry. My question is the situation, like, it's really hard for me to deal to to defend myself here because I have no resource, nothing, nobody in my side except that she was arrested and I was lucky. So today I'm in the situation, I don't know, I have my kids with me since last 8 months. The question
So
is,
Ashish, it sounds really like you're going through a very hard time, and I think a lot of people on this webinar can relate to that, and through either real lived experiences or through research or through being a service provider. It sounds like Justin is prepared to help you offline, and so I'm going to redirect and ask to see if somebody else has a question that's specifically related to the research I've presented on the previous 6 slides. So I really wish you the best, though.
Thank you.
Yes.
And I'll just add, it's very normal that we're going to have people in the webinar for whom this is, of course, a personal, serious issue. We're not trying to minimize that. In fact, we do have a number of services specifically for men who would benefit from it, for them and their children. It's just about the appropriateness of the questions in this particular forum. What I'd like to do, though, is if anybody, Ashish and others, do need support, need help, that's what we're there for. Why don't you should be able to chat with me directly. You can do a private chat. You can also email me, and I'll put the email address in the chat bar. Or definitely contact us, the Center for Men and Families. We want to help you, but we just have to keep moving in terms of covering all the ground for tonight's event. So one quick additional question. You have 2 more minutes for that, Professor Douglas?
Yeah, sure, that's fine.
Okay, let's go to Eric, who I think is next in the queue here. Eric,
Okay.
go ahead.
Hi, Eric.
A quick and direct question, if you would.
Hello, doctor. I just wonder if you've captured any statistics on, you can hear me, in households where the husband, or father, boyfriend was the target of abuse from the mother, how likely were the children to also be targets?
Right, yeah. We actually have not captured children's physical victimization or really even psychological victimization. That's something we would like to do in the future. It's a higher bar in the research domain because it means that you're reporting about children being harmed, which means another layer of sort of ethics protocol and review, which is why we avoided it in the first couple of rounds of our research, but it is something we would like to address without any doubt. And we also know that there is a very strong correlation between domestic violence and child maltreatment. And it's something that the child welfare system deals with the intersection of these quite a bit. So sorry, I don't have specific information for you about it. It's definitely a place that we'd like to take our research, though.
Thank you, doctor.
Yes. Okay, I'm going to get back to the presentation now. Okay, great. And the question is, will it have advanced with me? No, it hasn't advanced with me. Okay, no problem. So this next area is around men's experiences with help seeking. So I'm going to talk to you here about research results from 2 different studies. The first is an international focus group study of men in 4 English-speaking countries who experienced partner abuse. I think is actually technically the language that we used. They didn't have to have experienced a physical assault. It could also have been psychological or controlling behaviors. Australia, Canada, the UK, and the US. We interviewed 41 men in 12 different focus groups. And also I'm reporting on here those first 300 men who were part of the first research study that remember I talked about study 1 and study 2. We asked men quite a bit about their help-seeking experiences in that first study. So, all right. So when men go to seek help, it's true for women too, but it's different for men. They have really a lot of internal and external barriers to overcome in order to move forward into the help-seeking realm. So let's talk a little bit about the internal barriers of what prevents men from leaving. So when you ask men, why is it that you have not left your abusive relationship? Men provide these results, these answers here. And as I recall, I don't believe can't remember if these were check boxes or men just provided these responses and we categorized them. They're concerned about the children, about 90% of them. Marriage is for life, 85% say that. And over 3/4 of the men say that they love their partner. About 71% say that they are worried that they'll never see their children again. Over half believe that their partner has the ability to will change. Over half say that they don't have enough money to go somewhere else. About the same amount say they don't actually have somewhere to go. A similar amount says they're embarrassed that other people will find out. And then about 50% say that despite the abuse that they are experiencing from their female partner, they don't want to take the children away from their mother. And as you know, as a society, we really, the bond between a mom and a kid is often viewed as sort of a sacred bond in some way. And about, well, it's under a third, somewhere between 1/4 to 1/3 of the men say that the female partner threatened suicide, or and 1/4 said she threatened to kill somebody else. And you know, these are actually similar rates of what women say when you ask them about why they stay in an abusive relationship with a man. So the types of internal barriers that men grapple with when they come forward to seek help is that men are less likely to seek help than women overall. We're not even talking about partner violence. This would be for any type of physical or mental health problem. They're just less likely to seek help. So, and then when you couple that with an experience like partner violence, which is something that isn't supposed to happen to men, it just exacerbates that normal tendency. So men are even less likely to seek help when they think that others see their problem as something that men should be able to handle themselves, or something that men don't do, or doesn't usually happen to men, something that we call non-normative behaviors or experiences. Other types of internal and external barriers to seeking help. Men really talk about having trouble conceptualizing that what they are experiencing is partner violence. I remember when we were running our focus groups, a man said that he was sitting in, and I have a vague memory that this person was a physician. I could be wrong, but this is what I remember. That he was sitting in a lobby somewhere, like for either a legal office or a medical provider or something. And he saw this little pamphlet, and it said something like on the outside, are you sometimes afraid of going home? Do you walk on eggshells when you're at home? All of these kinds of list of behaviors. And he was like, oh, that's me. And it opened up the pamphlet and said, you might be a victim of partner abuse. And he went, what? Me? Unbelievable to him. This sort of wake-up call when it wasn't about gender, it was broken down into behaviors that somebody might experience as a target of these kinds of behaviors. So men do talk about having trouble understanding that what they're experiencing is abusive. They're shamed and embarrassed. Those who do understand have conceptualized it. So embarrassed that it's happening to them. Women also are embarrassed as well, but there's this idea that you can't really be harmed by women. What's wrong with you? I remember a man reported that he called the cops one time, and the cops showed up and they said to him, what's wrong with you? Can't you control your woman? Which of course is just, there's so many things wrong with that kind of statement, as we know, both toward men and women, right? Domestic violence services are most often geared toward women, and they're often located within women's agencies like the YW, or they have women-oriented names like Harriet's House or Mary's Hope, and men say, well, those aren't places for me; those are places for women. And as on a related note, men have trouble locating resources that are available to them, and then they've often had negative experiences with help seeking. They've been ridiculed in some way, so it requires them to overcome a lot of barriers in order to move forward. And so here are some examples of these barriers. This man says, I just took it. I didn't call it abuse for a long time because I'm a strong guy. I'm strong-willed, and I don't take lightly to anybody telling me what to do. Yet I had this woman that was able to control me. Another man said, there's lots of information. I never saw it as abuse. I thought it was me, I thought, well, I must be screwing up somewhere. It's got to be me. Why would anybody do this? And in the short term, though, I think a lot of men, like I did, make excuses. We don't recognize that it's domestic abuse. This man said, I found that very, very difficult, because the comment was coming back was, you must have done something to cause the violence. Now, for that to be coming to people who are supposedly professional, it blew me away. It really did. So yeah, that's been my experience. So we asked men specifically about their help-seeking experience in these 6 different domains. Some of them are informal and some of them are formal. And what it is, it's ranked here in the prevalence of how often, what % of the men reached out for these specific resources. I think I have a slide a little bit later that talks about friends and family, clergy, and legal professionals, I think. All areas to be explored more in the future. But about 2/3 of the men in our study said that they had sought help from a mental health provider. About 2/3 talked about the informal support they got in an online version. About half, just under half, sought help from the police or domestic violence agency. Less than a quarter received help from a domestic violence hotline, and even fewer received help from a medical provider. Usually those who have some kind of serious injury who go to a medical provider. So these next set of slides, well, no, I'm not there yet. Okay, so we asked the men in a 3-point scale, how helpful was the resource? And the options were not at all helpful, somewhat helpful, or very helpful. So when we're looking at the % who experienced them as helpful, it includes those who said somewhat helpful and very helpful, and it excludes those who said not at all helpful, which makes sense. But I guess my point is, even those who said it was somewhat helpful are included in these statistics of it actually being helpful. Okay, so how helpful was this resource? And I'm going to break down each of these resources for you in just a moment. And what we have here is an overview. So we see that over 75% of the men, over 3/4 of the men, said that the medical provider was helpful. And that's the most strongly rated one. Followed next by mental health provider, about 71% said that it was a helpful resource, and online close to 70% as well. Domestic violence agency and police come in under half of the men said that it was helpful, and less than a third said that the domestic violence hotline was helpful. So in these next few slides, I'm going to break down each of the different types of resources that they sought help from, and I will provide you first with this where it says number 1, when it describes how helpful it was, and then number 2, where I will have additional information, and then I will follow that, I believe, with quotes. Yes, that's right. And I've got it here not by ranked order. It is presented alphabetically, if I'm remembering correctly. So how helpful were these agencies? Were the domestic violence agencies? And you see that 65% say not at all helpful, not a very good showing. And then we have additional experiences with domestic violence agencies. Gave the impression that they were biased against men. About 95% of the men said yes. Said that they don't help male victims, over 75% of those who had this experience. Suggested that the man was the batterer, close to 2/3. Okay. And this man said this, and here we have some quotes. This man said, they just laughed and hung up. And the next one said, they didn't really listen to what I said. They assumed that all abusers are men and said that I must accept that I was the abuser. They ridiculed me for not leaving my wife, ignoring the issues about what I would need to do to protect my 6 children and care for them. Okay, so that's domestic violence agencies. Next up is domestic violence hotlines, okay? How helpful was this hotline? We see not at all helpful, over 2/3 said it was not at all helpful, and we've got, very helpful is not even 8%. And then the follow-up questions, additional experiences with DV hotlines. They said that they only helped women, about 2/3 said that. Referred to a batterers program, about 1/3. So these are men who call for help. They're given a phone number, and when they call that phone number, it turns out to be for a batterers program, right? And I wouldn't be surprised if some of you who are here on the call had that experience happen. They were given references to a local program that helped, so that's a positive thing, over a quarter. And given a phone number that turned out to be for a batterers program. Sorry, I guess I'm confusing these two examples here. That's about a quarter. And then just being referred to another hotline, which could be a neutral experience, the way it's presented here. And then the quotes that we have here. This man said, the first man, they were confused, belligerent, patronizing, offended, indifferent. They thought I was making up a story. The next man said they laughed at me and told me I must have done something to deserve it if it happened at all. The third quote here is they asked how much I weighed and how much she weighed and hung up on me. I was told by this agency I was full of BS. The fourth man here, fourth quote, told me that women don't commit domestic violence. It must have been my fault. Another one, they accused me of trying to hide my abuse of her by claiming to be a victim, and they said I was nothing more than a wimp. When I called to explain that I had been hit, they kept misunderstanding me and asking me who I hit. It was frustrating. Okay, now we're going to move on to the police. Okay. How helpful were the police? So not at all helpful. So we're at about half of the men said that the police were somewhat helpful, right? So in the 44%. Oh, so additional follow-up, the outcome of contacting the police. No one was arrested is about half. They arrested my partner, about close to 20%. Arrested the help seeker, close to 26%. Arrested both, getting close to 10%. Now I know that this looks like arrested the help seeker looks like a lot more than arrested the partner. It's close to a 10%, 10-point difference, 9-point difference. If you actually do the statistics behind this, there isn't what we call a significant difference. But what that also means is that there's no difference. The men are calling for help and the female partner is just as likely to be arrested as the male partner, okay? And the follow-up quotes that we have here for the men's experiences with the police. The first response, they arrested me even after she turned on them. They did nothing. The second time, they just wrote a scathing report against her, but did nothing. The second man said they asked her to confine herself to her bedroom. She was drunk, and they asked me to sleep in the baby's room. We did. She passed out, and they left. So you might think about how this scenario might have played out differently if the victim had been a woman, if it had been two women in a same-sex relationship, two men in a same-sex relationship, etc. The next example here we have our medical providers. So those who said not at all helpful, you can see that that's a much smaller group of men. These were very helpful was a quarter, and somewhat helpful were half of the men. And then additional experiences of those who sought help. Asked about how they obtained their injuries. Close to 100% had that experience with medical providers. Now then, how many of those men were honest about how they got the injuries? Somewhere between half and 2/3. And then did they receive info from the provider about getting help? And it's a very small percent, as you can see. But of course, if we have about 50%, 50 to 60% who were honest, it's only that group that you can then ask, did you receive info, right? It's not the entire group because if they weren't honest, etc. That's right. I don't think we actually have some quotes from the men around the medical providers and mental health providers. So much more positive experiences with mental health providers. And additional experiences with mental health providers. They took their concerns seriously. About 2/3 of the men say that they felt that was the case. And under a third, though, received info for getting help for IPV. And I don't have any quotes from the men about that. But let's talk about why do positive and negative experiences matter? And so we know that for each additional positive help-seeking experience a man had, so that's each one, additional positive experience they had, they were 43% less likely to abuse alcohol and 30% less likely to abuse drugs. And for each additional negative help-seeking experience, each one, they were 37% more likely to reach the clinical cutoff for PTSD, right? So it really matters. All right, so I am going to stop sharing my screen. I have one last section to do with you, which is more on the good news. but if anybody has questions that are specific to the data that I just presented around the different help-seeking scenarios, I'm happy to take up to 3 questions, depending on time, to answer those questions specifically.
Okay, so we'll try to do some quick questions. Don's had his hand up for some time. Don, why don't you start with the first question? Oh, I'm sorry. I thought I gave you talking privilege. There we go. Go ahead, Don.
Hi, Don.
You may need to unmute.
Yeah, you're muted, Don. This is my life on Zoom, like many of us these days. I can talk about what a clinical cutoff is, if somebody wants.
Okay, Dawn has disappeared.
Okay, let's try another one. Peter. Hi, Peter. You're muted too.
Okay. Hey, hi, how are you? Can you hear me?
Yes, yeah, all set.
Okay. Now, when it came to police, or it came to care providers, was there any correlation between male police and male providers and female police and female providers? Because what I found was that the male police shamed me, blamed me, told me I was responsible, told me if I hadn't been there, I wouldn't have been assaulted. And ultimately, it was a female military MP who actually kind of started the ball rolling. And
Wow.
I found surprisingly, females are much more sympathetic than males were.
Well,
And I'm just wondering if you found any of that.
Well, I'm really glad it sounds like you had a positive experience at some point with the police. That's really wonderful. But we actually didn't ask about the gender of the police, but that is something that would be wonderful to explore in the future. So thanks for planting that seed. Yeah.
Yeah.
Okay, Justin.
I think that's probably the only positive part I had with the police was the
Okay.
female police.
All right, good to know. Well, I'm glad that something good did happen out of it.
Thanks, Peter. Let's go.
One more question,
You
Justin.
want to do one more, or do you want to continue? Yeah, one more. Okay, so that's
Yeah, sure.
going
We'll
to be
take one more.
James. Go ahead and please unmute.
Hi, James.
Hi. So my question pertains to, say if somebody has a negative experience, it's not going to work if they complain directly about it. Would it be worthwhile to go through another organization like CAFE to put the complaint through and kind of keep yourself anonymous and have like the power of an organization bring that issue up with some of these organizations who are obviously biased and unfair towards men?
Do you mean like a class action suit?
Well, not really, but it's just, let somebody else put the complaint in for you so that you're not directly complaining, because they're obviously going to have a bias against you if you directly complain to one of the organizations like the helplines.
Well, I don't think these men are necessarily complaining to the helplines. They're calling and asking for help.
Yeah, but what if, say, one of these men have a negative experience with one of these helplines and they want to complain about the negative experience? Would it be worthwhile to have somebody do it on your behalf?
Yeah, it may be. It's possible. I think what's happening with a lot of these men is that they don't know who else to go to. All they know is to call the police if they're having a problem. And that, many men are not aware that there are organizations to provide help and support to men. And historically, there really haven't been. So this is a much newer phenomenon. So,
If I may, just real quick, the class action is an interesting idea, and it's something we are in fact exploring. We're sort of approaching this from a carrot and a stick, carrot and stick avenues. So the stick being the class action, the carrot being more the outreach and the one-on-one meetings with key decision makers within these agencies. That's as it pertains to the police. With respect to some of the other helpline agencies or social service agencies, we're actually making progress doing workshops and trainings and webinars actually like these. And a couple of people actually on this session tonight are involved in that. You know who you are. And that I think is a better approach, is to the agency to agency educational opportunity to improve the way agencies are functioning by getting your foot in the door and then being able to share some of your resources and your best practices with these agencies that a lot of them mean well, they just don't know how to do a better job. And maybe there's a role that can be played by organizations like ours who, who do the research and speak for predominantly a male clientele who are experiencing this kind of.
Yeah, and I guess my perspective is if they already think that I'm going to be a batterer when I'm complaining about somebody else doing the battering, if I have a negative experience and I complain about it, they're just going to ignore it because they're going to continue to think I'm the problem because of who I am. So that's where I'm coming from, I guess. I don't know if that makes any sense.
Okay, thanks for sharing that, James.
Okay, we're going to go forward now with the last section of the presentation here. All right, so I've got to get down to the next section, which is really where there's some good news, which I'm really excited to talk about with people. All right, so there is some good news. We've been seeing examples of outreach that is gender inclusive. This, I think this, I don't know if this comes from the UK, I can't remember, but you can see this is what I talked about before, this kind of, sort of like a behavioral checklist of things, Domestic violence can start at any time. Look for the subtle signs: controlling, isolates you, cruelty to animals, criticizes you, jealousy and possessive, cruelty to children, etc. Public education. This is from Virginia in the States. Domestic abuse has many faces. Here we have face the facts. Men are victims of domestic abuse. Domestic abuse can be verbal, emotional, physical, blah, blah, blah. People of all ages, education, income levels, and religious affiliation experiences. This is from the Jewish Coalition Against Domestic Abuse. Here we have, this says, just because I'm a male doesn't mean she can't hurt me. I'm human too, but no one believes me. Here we have from Bergen and Associates Counseling in Canada, 17% of reported DV victims in Canada are men. It is thought that many more men, don't report. And then I really like this. Yes, seriously, did you laugh? Yeah, that's why more men don't tell others they are experiencing violence from their partners. This is from the Dallas Observer in Texas. So this is talking about a shelter, a domestic violence agency that does provide shelter services called the Family Place. And they opened, one of the first shelters for men in the country. What was happening with them was they were actually spending so much money on hotel vouchers for men and their children who were coming forward that they realized that if they just bought a house and put men and their children there, they would save money. And so, because they were seeing so many men come forward with requests for help. This is, I also happen to know about this one because I was interviewed for this one. So this is from Mel Magazine, and they also were covering the new shelter in Dallas. But this is more media attention is my point, I guess, really here is that there's a lot going on. The media is really starting to pay attention to this. This is the Los Angeles Times. Again, this is covering the Dallas story. There was a lot of publicity around that at the time. It's hard for a guy to say I need help, right? And then National Public Radio covered this as well, which is really exciting, I think. And then in the US, the federal government has actually been hosting, so there's a division within Department of Health and Human Services called the Family Violence Prevention and Services Program, sometimes called FIPSA, which is it's named after the Act for FIPSA, Family Violence Prevention Services Act. So this is the program that comes from the Act. And they've held 2 roundtables in Washington, bringing together service providers who are providing services to men, and not with naysayers in the room, people who are actively doing the work, who really want to talk about the challenges, ways that they've adapted, how to reach this population, how to provide services, etc. So it's really, these are people who I consider to be so brave, progressive, right on the leading edge of doing really excellent work, doing things that are really hard. And so, you know, I guess I would just close that at least here in the US, and I'm hearing about similar kinds of things across parts of the globe. I was in Germany and was a guest speaker there and was hearing similar stories in Germany. But all over, we have domestic violence agencies that are working on services, housing, and staffing issues for men who come forward and who need help. And the kinds of questions that are being asked are, do we provide gender specific services or do we provide gender inclusive services? You know, do you include men in psychotherapeutic groups with women, or do men actually need a different kind of service that women have? Can you bring men into a system that has been set up to serve women and then just give them the same services, or do they need different services? And then is it mixed housing or gender specific housing? And then really working with staff in terms of bringing in a more diverse group of staff. The domestic violence agencies have historically employed a lot of women, which made sense, of course. And now it makes sense to have men on staff too. I was called by somebody in Nebraska who works at a facility has the word women in it. I can't remember, like Women's Outreach or the Women's Center. I can't remember. And he said that they had hired him because so many men were coming forward for victim services, and they felt like they didn't have any men on staff, I believe is what they said, and that they were really looking for a way to meet this population, that there was no way to ignore it anymore, that so many men were coming forward for victim services. So hiring more in terms of gender diversity, diverse staff, and I would imagine also sexual orientation, and working on training with staff, and our own biases and beliefs that we all bring to the table, regardless of what kind of work that we're doing, because we all have our own set of assumptions that we make around domestic violence or really anybody we interact with, right? So anyway, this is a list of publications. All this stuff can be found on my website, which I'm happy to provide, and also my email address I can provide as well. So anyway, that's the end of my prepared slides. I see that we're actually a little bit close to our end time, but I'm more than happy to stick around and take some additional questions. So Justin, I'll let you figure out what is the best way to do that.
Okay, well, thanks so much for your presentation.
Yeah.
Parts of it were horrifying, actually. Some of those quotes from some of the men, but you ended on some uplifting messages, which we always appreciate, and try to be positive in all of that. So let's go right to questions. I see Deborah with her hand up. Why don't you start us off, Deborah?
Hi, Deborah. Unmute. Hello.
Hello.
Hi, can you hear me?
Yeah.
Hi, sorry, I'm in the UK. It's almost 2:30 in the morning.
In the middle of the night. Yeah,
it is. Yes.
Anyway, nice to have you with us.
Well, no, it's an absolute pleasure. I'm a PhD candidate. I'm working under Professor Nicola Graham-Kevin.
Oh yeah, Nicola, sure.
Yeah, and I must say I found your work inspiring. I look at adaptation and recovery for both male and female victims of partner violence. I currently have a survey running that's approaching 1,200 participants. Some of the big areas, it's gone global. I never thought it would. But some of the big areas are clearly matching with your paper on for English-speaking countries. But I've also had quite a huge reaction from India.
Wow. Yeah.
So we've had, I've got 361 participants from India at the moment.
Wonderful.
It's fascinating. I'll be happy to share the results with you if you were interested. But one of the questions I have for you is that I've had some visceral reactions to my research, despite the fact that I research both male and female victims. Why do you think that is? You've obviously been in this longer than I have, and I'm sure you've experienced it, but why do you think that is such a reaction?
Well, so the domestic violence movement, if you will, say, or the field, the birth of the field of domestic violence research, and then the establishment of the social service system and so forth, really was closely tied to the women's movement. And initially, we could only understand partner violence through the lens of patriarchy. And without a doubt, patriarchy does explain some of the partner violence that goes on in the world, and certainly in places where women don't have a lot of rights to vote or to drive or to make decisions about their own lives and so forth. But some people are very wedded to that, and if you're very wedded to that belief, then it's hard to conceptualize that partner violence could exist in any other way. But I think that it's actually, in many ways, as we have seen families and couples be more diverse, or that has become a more public thing and a more socially acceptable phenomenon, you have to look to other reasons for why partner violence can exist other than just patriarchy theory or patriarchy lens. And this includes things like, substance abuse and alcoholism and social learning, how we learn how to handle conflict and how to cope. And that some people use violence as a conflict resolution tool. And there are all kinds of reasons why somebody would use violence in an intimate relationship. In the early days of doing this research, we had people who would be really upset with us, very, very angry, who would outright deny. I actually recently was writing a paper for an edited edition. This is just within the past 6 months, and was asked to put in a disclaimer into my paper, the paper I was writing with Denise Hines, where we were asked to put in a disclaimer to say that our research had not corroborated the experiences of men.
No.
And my response was, I will be happy to do that as long as every single person who is a chapter for your special issue is writing in the same disclaimer, because my guess is that their experiences are not being corroborated either. So, there still is some pushback. It's not quite as bad as it was, but anyway. So Deborah, it's been lovely to hear about you and the work that you're doing. I just want to get on to some other folks. I hope that you'll send me an email. You can find me, just look me up. It's on my website, and I'd be happy to hear about what you're doing and to correspond with you.
That's lovely. Thank you.
Yeah, sure. Good luck to you. And get some sleep. And Justin, I'm happy to stay on after the 9:30 time. If that's, I don't want to be disrespectful of people's time, but I'm happy to stay a little bit longer.
With that, we may push a few minutes beyond
sure.
the end time. Okay, so let's move to Alan, I believe, is next.
Yeah, hi, Alan.
So, I have given you talking privileges. Yes. I'm sorry. Okay, go ahead, Alan.
Yes.
Please, your question.
Hi, I've been divorced for about a decade now, and it's been a very turbulent and hostile kind of divorce. There's been quite a lot of parental alienation and whatnot on her part towards me.
Sorry. Yeah.
Has there been any traction as far as making this kind of a domestic violence recognized kind of thing? I hear it's taking hold in the UK, but is it actually happening here?
Do you mean with parental alienation syndrome?
Yes.
Yeah. So actually, I don't mean to sound too academic for you or for anybody, or to go all on you is what I meant to say. There actually was a paper written by my colleague Denise Hines and also Jennifer Hartman, I can never remember exactly her last name, and Edward Crook, who is in Canada, about the idea that PAS, parental alienation syndrome, constitutes a type of partner abuse. So there is some traction. I will also say there's still a tremendous amount of pushback. Many people just don't believe that PAS is a real thing. They don't believe it's a syndrome, or there are any number of reasons. They believe that the research on it has been particularly bad, without proper checks and balances and so forth. So I think that the conversations are still going on. But if you look up, I guess if you just email me, I can try to I have that citation and I can send you. It is, I only know of it in an academic paper, so, but I can get it for you and send it to you.
That would be awesome. Thank you very much.
Good luck, Alan. That sounds very tough.
Sorry, didn't follow my own rule and I was muted. Let's go to Allie. Go ahead.
All right, Allie. Hi, Allie.
Hi, can you hear me okay?
I can hear you.
So I'm a law student, and my area of interest is where male victims of domestic violence intersect with the criminal justice system.
Sure.
So I'm wondering if you have any statistics or any information on what the outcomes are from male victims of domestic violence if they do end up reaching the prosecution stage.
So you mean that they are prosecuting against a female partner?
Yeah.
Yeah, or a male partner, or I guess it could be a male partner too.
Yeah.
I don't. I'm so sorry. I really don't know of any work in that area. But if you send me an email, if you look me up and send me an email, I can ask some of my other colleagues to see if they know of anything in that area. I'm trying to think of just now. I really haven't seen anything in that area. So it sounds like something that should be done.
Yes, I agree. Thank you.
Yeah. All right. Good luck with law school.
Thanks, Allie. Let's go to Eric. Go ahead, Eric.
Hi, Eric.
Sorry, I couldn't find the button. Now I'm.
It's okay. It happens.
I'm an old guy, and I've been in this for a long time.
Yeah.
And in the mid '90s, I guess, I was working with a guy by the name of Butch Windsor, who was actually a good deal more skilled than I am. His main interest was local politics, and he was working with the police. And because of his working with the police and contacting them a lot, I attended a number of meetings with the police, and we were asking them, what is it that controls your reaction to a couple that reports a violent situation? And I'm wondering, is there research on that? Because what we found was, this is again mid-90s, but we found the Duluth wheel, and we found that police manuals were evolving with changes to the law, and that the police really conform to what the chain of command tells them to do. I guess my question is this: since the police are that first point of contact with so many cases, I see a tremendous opportunity for research into what forms the police attitudes, how policing manuals are written, what the culture of the police does to the response to situations in which domestic violence has been reported. I'm wondering, is any of that being done? Because way back when I was doing this with the Toronto police, there wasn't anything. You could not find any research at all.
I seem to recall that there is some research out there that is specifically about how the police feel about domestic violence cases in general, but not, and I think that would have been, well, not in general, that would have been, a more dated perspective of just only looking at women as victims. But I don't recall anything recently coming up. I will say, though, that most of my work is not specifically in the criminal justice area. It's possible that Alexandra Lasova is on this call. She's one of my colleagues, and she does work in the criminal justice area. I'm not sure I'm supposed to be telling you to email Alexandra Lasova, but she's at Simon Fraser University, and that's a possibility that she might be able to help you out. So.
Well, I can't say that I'm in this now.
Okay.
I'm a dual citizen. I've been in the States for the last 17 years.
Mm-hmm.
And although I was very active in Canada, I decided that I would not be doing politics in the States. But if you are going to try to change behavior, you're going to have to find out what the currently dominant behaviors are and where they come from in terms of the motivation of the people that are applying them.
Mm-hmm.
And I'm just seeing a very long road ahead of us in which, to my knowledge, there's no guidance at the moment.
Yeah. Well, you know, I think that it was a long road to get us to where we are in terms of just getting police to respond to domestic violence as something that's more than just a private issue, right? And that took place in all kinds of different forms. Those are like informal trainings and formal trainings, and it being written into police academy manuals, and changing state statute and federal statutes. And, you know, but my personal sense, and this is not based on research, this is just my sense of somebody being in the field, is that it won't take as long to move the needle toward understanding that victims aren't just straight women, that victims can be lesbians and gay men and straight men and trans individuals. And so that, I mean, that is my sense, that the biggest hurdle was understanding that this is in fact a public issue, with really a public health issue, a criminal justice issue. And I think that we have the criminal justice system who've made that transformation for the most part, you know, to understand that this is more than just something that's behind closed doors. And then the next hurdle is to understand that this can affect anybody regardless of race or gender or sexual orientation. So, I mean, I guess I'll also say that, you know, while I've presented results here which show that the men in our research are largely dissatisfied with the response that they get from the police, there's a lot of research which also shows that women aren't that satisfied with the response that they get from the police either. So I would say that there's work to be done across the board. I think that most of my work and most of the work that I'm most familiar with has really more focused on the social service sector, and understanding sort of the attitudes of people who pick up the line, the first people when you call a DV helpline or agency, and their capacity to help people who aren't just straight women. So anyway, thanks for your question, Eric.
Thank you,
Well, thank you. There are 100,000 good things to do.
There you go.
And we don't have that many people yet to work on it.
Yeah.
But I really appreciate what you have been doing.
Thank you so much. I appreciate that.
Thanks very much, Eric.
Thank you, Barry.
Okay, so I'll just say that we have a few people who have asked questions through the Q&A function, and if any of them want to real quickly raise their hand and ask those questions directly, we can squeeze in maybe one or two more.
Sure.
So just give a couple of minutes for people to select to do that. In the meantime, there was one anonymous question, so I'll read that out real quick.
Yeah.
And this person says that in response to someone else's question, this was a little bit earlier in the conversation, you said men who experience psychological aggression, coercion, tend to experience PTSD. Do you have a figure of how often that goes undiagnosed, or is that an impossible figure to have? I'm wondering what the proportion of care providers is that refuse to acknowledge that diagnosis, especially if the man already has another diagnosis like anxiety, depression, etc.
I'm so sorry. I really don't have an answer to that, and I'd be afraid to even speculate about that. So, I mean, all I can really say is that men who have, negative experiences, men who experience partner violence are more likely to have post-traumatic stress syndromes, and that the more negative experiences that men have with help seeking, the more likely they are to have PTSD.
Gotcha.
That's
And I'm going to ask
what I
just
can
one
say
other
about it.
question from the Q&A stream, and that's just about if you're aware of the statistics, that any differences, sorry, my cat is trying to clop me behind me. I'm hosting this at home, between Canada and the US, and I'll just broaden that and say in other parts of the world as well, say the Western world, do we see major differences from country to country?
In terms of partner violence victimization or the responses, or?
I think the question was about victimization specifically.
Okay, yeah, well, we see higher rates in the US. I'll just say that.
Specifically for men or just for all categories of victims?
We see higher rates overall, and that includes men and women, as compared to Australia, Canada, the UK. So.
Okay, great. All right, so I think we're going to wrap up there. I'm sorry we can't take every last question, but
Yeah.
I did promise there would be a bit of a schedule. We try to keep to it.
Yeah, no, I understand.
Okay, so thank you for extending your time, Professor Douglas. Really appreciate that.
It's been wonderful, you know, and I'm sorry to now ask a question that's for me, but I would love to be able to read the chat history. So I don't know if there's a way that you can save that for me.
Yes.
I'd love to be able to get in there and just see what people's questions and concerns are, because when we hear from people, it really helps to sometimes give us a new direction in our research. And so I would be very interested, and my colleagues would be very interested in reading the comments that came in from a group of people who are really concerned about this issue. So
I will make those available to you, and I will also encourage others, and I'm not sure if it's only panelists or all guests who have access to this, but if anybody is interested in that chat history, there's an icon at the bottom of the chat bar. It's 3 horizontal dots, or a horizontal line of 3 dots. You can press that. You should be able to download it from there, but you may not, maybe nobody but me can do it because I'm the host. Okay.
So yeah, that's right. Yeah.
But I'll send that over to you, Professor Douglas, not a problem. I'll also say, I understand a number of you, this is obviously a direct and a personal issue for you or a loved one. Please understand that we do provide therapeutic services, legal services, and support groups of all kinds. And I urge you to contact us. I put my email address in the chat bar, but again, it's info@menandfamilies.org. That's sort of the primary way of reaching us, and then we can redirect you to the appropriate service or the appropriate branch or center. But please do get in touch with us, because we do want to be of support to you and your family. And let me just real quick, before I do a final thank you to Dr. Douglas, remind you the next webinar meeting in our ongoing series will be a week from today. So next Thursday, it's called Failing Boys or Failing Schools. So we're going to turn our attention to the educational achievement of young males. We're going to have Dr. James Brown, who is a former, now retired principal, teacher, school superintendent, also the author of Rescuing Our Underachieving Sons. I put the link to register for that webinar in the chat bar as well. So please join us again next week. If you want to support our work today, we would encourage you very appropriately to donate to the Family Shelter Campaign on GoFundMe. And again, I put the link in the chat bar. I'll put those links up again, so you can make a charitable donation there. But let me thank Professor Emily Douglas one more time for joining us tonight, lending her extensive expertise and sage wisdom on these issues to all of us. Really, really appreciate it on behalf of the whole group, who would be hard to get them all to come online and thank you directly, but I'll ask them to maybe into the chat bar, share their thanks. We're going to keep the chat going as we've done the last couple of times for at least the next 5 minutes. So if you want to keep chatting, you can do that. If you need to leave, that's okay as well. But thank you again for all of your time, and Professor Douglas, one more time, my appreciation. Thanks so much for being here tonight.
Yeah, well, let me just say it's just such an honor to be asked and to spend part of my evening with you and talking to you about something that's really important to me. And it's great to be able to see the impact of my work on people. And I will say that you can look me up, and I think what is my website? EmilyMDouglas.net, I think is what it is. And actually, you can find links to most of my research that's published. They are in academic papers. We do have victims who reach out to us with questions. I can't say I can always answer all of those questions or get back to everybody, but I would be especially interested in hearing from service providers. We're working with them a lot, and we're looking for opportunities to partner around new research ideas And so that would really be a wonderful thing that we would welcome. So thank you, everybody. I hope everybody is healthy. You and your loved ones are healthy and well in these very difficult times, and that you continue to be well.
Thank you. Thank you for those kind words. Thanks, everybody, for your attention. Hope to see you next week. Have a good night, everyone. Bye now.
Okay. Good night now.